All right, welcome back to the Dr. Doug Show. Today, I've got an interview for you with our lead health coach, Julia Priest. Now, Julia and I have been working together actually for the last several years, actually in a couple of different companies. She and I have helped to build group coaching, one-on-one coaching from a health coaching perspective, and more, actually in a couple different platforms. So I want to introduce Julia in this video. She is going to be very instrumental in building out coaching, both one-on-one and group coaching at LifeMD, our new platform that we're building out our programs on. And I want to start doing, if you guys like this, I want to start doing on a regular basis, kind of this coaching mentality, the benefits of health coaching. What are some of the things that everybody could be looking at, maybe should be working on? So today we're going to do more of a general overview of what the heck is a health coach? What's the difference between one-on-one coaching, group coaching? I give some personal examples about my own coaching experiences from business coaching, personal coaching, et cetera. And Julia walks us through one of the frameworks that she likes to use with patients and clients to help to kind of break through and flip the switch on their own headspace and direction that they're going with their health, specifically osteoporosis in this case. So if you don't know anything about health coaching, that's okay. If you wonder what the heck a health coach does, this is a great video for you. So take a listen to me and Julia Priest talking about health coaching and the osteoporosis space.
All right, Julia Priest, welcome to the Dr. Doug Show. So glad to have you on. And we have a lot of things to talk about. So why don't we start by doing this? Why don't you just gonna give the audience a sense of where you came from, how you got into health coaching, and maybe we'll just start there.
Yeah, that's great. So my background really originates in exercise science. I had a huge love for how the body moved and worked, and that's what I pursued for school. When I left school, I worked as an endurance cycling coach. So I worked really closely with athletes, and that was probably my first proximity to true goal setting and true transformations was working in that athlete relationship. Went on to do some massage therapy, again, just trying to increase my knowledge of anatomy, and then went into health coaching. So I went through the National Board of Health and Wellness Coaching. That's my certification that I hold. And the education I had was biased to kind of looking at genetics, looking at labs, looking at this kind of whole system and figuring out how we can tweak things to really give people the best opportunity for health. So yeah, and then in a short time, I met you and joined your team, which has been awesome, Optimal Human Health, and then worked with TOC, developing that with a great group of people. And that's where I find myself doing some group coaching, some one-on-one, and just trying to continue my understanding of health in general.
Yeah, that's great. Thank you. And what I'd like to do today is talk a little bit about just, what is health coaching and who is it helpful for? And I'll lead into that maybe just by giving some of my own experience. So I have, I don't know, probably 5 or 6 years ago, I was introduced to the concept of just coaching, not even health coaching, but just coaching, actually by Tony Robbins. So I went to his like the first event I ever went to of Tony Robbins, and they have this like massive network of coaches and different types of coaches and different price points, and it was just like a whole new world to me. I'd never even heard of this thing before, and so I engaged with a coach from that perspective. It was more business related. But since then, I've worked with like business coaches. Currently have a business coach. I have a personal coach. I don't currently have a health specific coach, but I have worked with health coaches in the past. When you and I both worked for the company Wild Health, I guess I didn't work for them. I did a fellowship with them. But when you were there, that's when I really got introduced to health coaching. And of course, I saw you doing health coaching there. So why don't you kind of just give us a sense of like, where does health coaching fit in? Because you don't see it in the conventional medical model. So where does health coaching fit in for patients that you have found it to be really the most powerful tool?
Yeah, I have gotten this question so many times from clients. So I really love that you're opening up this way because they're like, so you're the health coach and what do you do? It's just like, what do you do? It's a newer position in the model and it's not really understood what that health coach is going to help you do. And it's a fair question. Health coaching, I think, is really the applied part of the whole picture, right? So your providers are so well trained at making decisions, at seeing the big picture, at knowing those details of your health. Your dietitian, if you're working with a dietitian, knows everything that they need to know about gut health and supplements. the health coach is on the team to help you with your behavior change, the applied part, the taking the information and the doing the information. They're very different things. And I think some of the skills that health coaches have is seeing the big picture, being able to educate, being able to interview patients, and really open up a collaborative platform where the patient can get to know themselves better, which then in turn typically helps them with the changes that change their health. So it's a very cycle kind of approach. And I hope I laid that out in a way that's easy to digest.
Yeah, so I look at it from the provider perspective. I look at it as, these are the things that we as providers, especially those of us in the integrative functional space, these are the things we want to talk about. These are things we are passionate about. Like I love talking about sleep hygiene. I love talking about motivation and exercise and how do you do it, and all the pieces that go around leading a healthy lifestyle. But the truth is, even though in the OHH model, and we'll talk about how we're developing this, but in the OHH model, we had 60-minute provider visits. I know providers in the functional space that do 4-hour patient visits.
Yeah.
Because there's just so much information to relay. And us as doctors think yeah, if I just tell it to you all once, you'll remember it all. And that's unfortunately not how it works. And so really what we need is to set up a system where someone who can help the patients to carry forward these lifestyle changes can help them on a regular basis with regular intervals, with accountability, feedback, providing the tools. And it is a lot of back and forth. So again, to go back to my personal example, I am meeting with a coach in one topic or another at least once a week. Because if I don't do that, I know, because I've stopped in the past, if I don't do that, I lose traction. We all are so overloaded with information and goals and all these different things that are in our lives with the different people and the kids and the parents and the stuff, that you lose track of the things unless you're really, really diligent about keeping track of making sure your goals are crystal clear. So having a coach, if it's a health coach or a business coach or whatever, for me has been very, very powerful to help me to achieve the goals that I'm trying to achieve. So when we built out the OHH program, which we're now moving onto a new platform, when we built that out, we realized there's no way the providers can spend the time that they need to spend talking to the patients about the lifestyle that they're so passionate about. It's not that they don't know it, but the providers need to spend time talking about the medicine, the hormones, maybe the supplements. And that's where dietitians and actually overlaps with coaching too. But that's where there's a lot of overlap between the three of us. But we cannot spend the time or the frequency of time to actually drive home the lifestyle change, because that takes just so much more time. So I mean, kind of turn that back over to you and talk about that. There are a couple of different things that we've built out over the last couple of years together. Why don't you talk about sort of individual one-on-one coaching versus group coaching, which we've really moved to, and how you see those two differing?
Yeah, for sure. So I think group coaching has been, honestly, for me, it's been such a rewarding opportunity to see how community is an element of motivation. And I think that it lacks in a purely one-on-one coaching model. I think it's something that you don't get as much of. So I've really enjoyed seeing that aspect of community. When we host group coaching courses, there is so much back and forth in the chat. One of our other coaches, Edie, she uses an accountability partner project too. So people are having these really in-depth conversations with each other and supporting each other. And that's where they can normalize a lot of the feelings that they have around change, because they identify, wow, somebody else feels this exact same way. Whereas without that group coaching aspect, you might feel a little bit more in a silo where you don't know if your feeling of fear is normal or if your feeling of overwhelm is normal. Those are two really big ones for us. So group coaching just gives that community feel and really adds a value of support, I think, to the clients that are coming to that. It's also an opportunity to speak nuts and bolts about just what might need to be done to improve your sleep. You can really get a lot of information out to a lot of people when you have a group coaching platform. One-on-one, I see some of the attributes that are advantageous in one-on-one coaching is you can really get to know the individual right? And for me as a health coach, the better I know you, the more you share with me, the more I can help you expand as an individual, which might not be the same as someone else in group coaching. You might not need the same expanders. You might not have the same life experience. So the one-on-one coaching gives us more intimate ability to help people expand in their own personal development. So those are some differences I see between the two models, and neither is right or wrong. They just are very different.
Yeah. And so, as we are transitioning our practice, we made this announcement this week. So OHH, the company, was acquired by a larger platform. For those of you that missed that announcement, and that larger platform is called LifeMD. And so our goal in this acquisition is to take this practice that we have created around, definitely around osteoporosis prevention reversal, but it's actually much bigger than that. This is a health optimization platform. It can be leveraged to do basically anything. It's the same process if you wanted to prevent dementia, cardiovascular disease, metabolic health, lose weight, like all those things. So our goal is to take what we've learned creating this and then do it on a platform that is absolutely scalable. And they've proven that. They have served over 1 million patients. They're one of the biggest telehealth platforms, if not the largest out there. And they're growing so quickly, but they recognize that there is this space where they're missing an opportunity to help people and kind of meet them where they are. And so I've been bringing Julia with me, and what Julia's role is going to be is to help build out the coaching side of this. Because right now they do have some light coaching built in, but it's not consistent and it's not well defined. And so our goal together is going to be to build out programs from a coaching perspective that can serve a large quantity of people. And the reason why I bring that up is that group coaching is so powerful because you can relay a lot of this information, still individualized, but in not like a group of 1,000 people, but, in a group setting, you can relay the information about sleep hygiene and about, some of the emotional things. I'd actually love to talk about one of the things that you and I talked about before we hit record. These powerful tools that are just they're just little simple things that are going to flip the switch, but are not things that are easily done asynchronously, meaning like watching a course or like just watching a video on YouTube or something. Like there is an extra level. The accountability piece of group coaching is awesome. I still think there's value in one-on-one coaching. I still have a personal one-on-one coach. Her name's Sally Maxwell. And she's been, honestly, I think we've been coaching between 4 or 5 years now. I talk to her once a week or every other week. And it is, she just has helped me in so many facets of my life, from business to personal to relationship, et cetera. And it's worth it for me to have that one-on-one because I can really dig into the personal things. Mm-hmm. But depending on your starting point, group coaching is a fantastic way to teach a lot of people really powerful tools. And they don't necessarily need the one-on-one coaching out of the gate. Now, our challenge, and maybe you can speak to this, is, how do you set up a program that can utilize one or the other? And I don't know if you know the answer to that, but if you want to share anything about, your thoughts about how this might scale at LifeMD, and if you don't know, that's totally okay too, because we haven't built it yet.
Yeah, I mean, how exciting to be in an opportunity where you get to build these things and you have patients that want to change their lives. Like, it's just exciting, the opportunity. So even if I don't know exactly how it's going to look, I can speak to that excitement. When I think about it, I think that the group coaching will be the kind of starting point, honestly, to kind of get people in and get them used to a health coach style. And used to thinking about health instead of just the protocol and more about like, how am I interfacing with this protocol? Where do I feel resistance? Where do I feel ease? Talking through some of that language and making that language more part of their daily thinking loop when they are trying to go to bed at 9 p.m. instead of 11 p.m. And so I think the group coaching is going to be the first introduction. I could see a funnel where, hey, I love this group coaching, but I am really stuck here. I tried your protocol. I'm really stuck. Like I'm not moving forward. I'm past contemplating this. I want change, but I don't understand why I won't change. And then giving them a funnel to seek that one-on-one. Maybe it's specifically with sleep. Maybe it's specifically with stress, and they could come to us for one-on-one coaching there. I'd like to equip a lot of people too with just that base protocol of here's what to do. And maybe we have some group coaching sessions that are all just around mindset. So they're not even speaking to a pillar of health, like we think about exercise, nutrition, stress. No, it's actually just you're coming to this for mindset work. Let's work on that. So I think there are different ways to set it up. I think group coaching might be the first one that we pull on, just to get people really comfortable with a coaching model.
Yeah. And we've already built this out in the community, the Osteo Collective. And I know you and Edie have been working hard on that, and it's been very, very popular.
Yeah.
Very, very, very popular. So yeah, I'm very excited to bring that forward, because one of our goals too at the LifeMD platform is to take, what we're doing and do it in a more cost-effective way. And this is, I'm super excited. We're probably, months away from this, but, doing it in a more cost-effective manner. And then also potentially adding insurance, not to the coaching side, because correct me if I'm wrong, but I don't think insurance ever pays for coaching.
It's a harder one.
Yeah.
Definitely. There are a few CPC codes that they're working on trying to get approved, but it's a slow process right now.
Yeah. So, and the cool thing is though, like for when you're working for a company that has contracts with third-party payers, has Medicare contracts, they're big enough that they can actually push change. And so we can say, look, this is the improvement that we're seeing. This is a critical piece of this. We need to get this covered so that more of your, payers, more of your participants in your healthcare plan, if you're talking to an insurance company, more of your participants can get the benefit. And that actually, they're big enough to actually make that push, which is fantastic. So our goal is to get that started. And then of course, dietitian visits and dietitian work is when the functional testing can all be covered. The physician visits can all be covered, or at least partially covered. So just as a great opportunity for us to continue to bring down that cost and increase access, which is ultimately our, part of our mission.
Yeah, absolutely.
Yeah. So then, awesome. I know that we were talking about one of the tools that you like to share from a coaching perspective. I'd love it if we can just kind of wrap this up, because I bet right now people are still thinking like, yeah, I don't know what you do. Like, I still don't know what you do. So maybe just show us one of these tools, because I've actually seen this tool before. And I think this was done in one of the, I don't know, maybe one of the men's groups that I've been a part of, like these, men's like coaching groups. And I think it's really good for both men and for women, but I'll let you describe it, and then I'll just say that this is just one of many tools that we can pull out and help to educate people, to help them just to flip that switch and be like, oh my God, I've never thought of it that way. And then once you open up that space, then it's a totally different game. So go ahead and tell us about the Johari window.
Yeah, absolutely. So the Johari window is something that I don't know. I'm going to make a dumb sports analogy. Like a coach on a sports team has plays that they're thinking of in the background. Like what play is appropriate for this situation in the game, right? And so sometimes that's how I'm thinking. Like what tool or what play could I pull out right now that would really help this athlete do what they need to do, or really help this client do what they need to do or trying to do. So that's how I think about the Johari window. It's rooted in personal development, and it was by Luft and Ingham in 1955. They came up with this model. And you can kind of see this. It's pretty self-explanatory, but if we work on that upper left square, this section is things that you already know well about yourself and other people know well about you. So if someone was to just describe you, if you pulled somebody over and said, hey, describe me, you both would agree on these attributes that you hold. That's in the public area. The blind spot are the things that your colleagues might say about you. They know this well about you, but you might not realize it in yourself, right? Or peers, or, people you work out with, people that you socialize with. They're going to have this information, but you might not have it. On the lower left, we have this private section, and that's the things that you know about yourself, but are maybe not revealed to others. And then the final bottom right corner is this unknown section, which maybe you haven't even traveled there yet. You haven't had self-exploration here, or it's even unconscious. The whole concept of using this, right, is to expand. So trying to make your box bigger. And the ways you can do that, you see those green arrows. You can share with people, so you can tell them more about yourself, which expands and makes less private information. Or you can solicit, so you can ask people for feedback, and that reduces your blind spot area because you're getting that things they know about you from them. And when I think about this in a health environment where we're working on wellness, or we're working on our health, a lot of the things that your providers know might be the blind spot for you. They can tell you, oh, hey, metabolic health isn't really where we want it. And it's probably because you are super stressed, you're eating this way, whatever is causing your glucose to go up and your A1C to go up and your insulin to follow that, so they might be giving you blind spot information. And then with a health coach, that's where a lot of times we're growing into that private area. The more you're sharing with me, the more we're knowing about you, the more assets we have in terms of changing your behaviors, because you're making that public space bigger and bigger and bigger. I'm knowing more and more about you, and we can change or have higher ability to change things as you expand that whole box there. So those are some specific things that come up when I'm coaching someone. I'm like, all right, what does the provider know? What are they willing to share with me? What do they know about themselves? And how can we use this then when we want to change the foods that we're eating?
Yeah, it's really cool. I'll give another personal example because I actually just went through this similar process just yesterday with my coach. We're actually talking about the Johari window, but it's just kind of the way that the conversation was angled. And so we were just talking about this transition to LifeMD and how, over the last, really since the time that I've been working with Sally, she has helped me to go from orthopedic surgeon to entrepreneur, functional medicine doctor, and then now into, exiting out, becoming the VP of women's health, hormone, and lifestyle optimization at a publicly traded large company. There's such a mind game associated with those major changes, like stepping out of orthopedics, starting a company with zero education in being a business owner, and then moving into women's health, hormone health specifically, which is one of the most controversial areas, and then moving into a very public, like a public position of being on a publicly traded platform in a large company, and open for a lot of criticism, right? I mean, talk about the potential for feeling like I'm an imposter, like that imposter syndrome.
Yeah, right.
But what's amazing about like working through this kind of work is that we talk about the things that are out in public and people what everybody knows. Now Sally knows me well enough. She knows a lot of that private box for me because we've talked about, again, relationships, parenting, personal, like everything down to the, like I don't not share anything with her anymore because I know the more I share, the more benefit I get. So she can really dig into those things. And then as I bring up, like, what are the emotions that are around this thing? Like, for example, for this feeling of like, like, how did I get here? She can help us to kind of like navigate around that. And then we end up really exploring this unknown box where, these are things that she didn't know. These are things that I didn't know. But this is sort of how things have developed. And then again, it's like for me, it's like a switch. Like once you switch that, or once you flip that switch, you just open to a whole new world. And it helps you to maintain your vision and your focus. And you're like, oh, I'm here because of X, Y, and Z. I'm here because, and this is just a great personal example. You're like, how come I was able to build this company to exit out? And she said, it's, really it's because you learned how to be authentic. You learned how to lead from your heart, and you're so clear in your mission. And when you're those three things, people want to follow you. People want more of that. Right. And so that's how we were able to kind of navigate through this really murky functional space and end up in a space where we have a tremendous opportunity to grow and to take what we've done at small scale and take it to large scale and help not a couple hundred people a year, but thousands and thousands of people a year. So it's the power of this kind of work that really gets someone through this. And that can be in their, their personal health journey, which is what you'd be helping them with. It could be in a business journey. It can be on a relationship journey, like all of these really challenging areas of our life. This type of work is very, very powerful.
Wow. That was really exciting to get to hear. And I just, so lucky to watch you evolve, and so lucky that Sally's working with you to help you do all of those things. Sounds like you guys have a great rapport. And I'm really curious, this is like an earnest question, does she use a lot of reflections when she coaches you? Reflections are like repeating back what you have said in a similar or in a kind of, in a similar way. And sometimes it pulls out more info. So I wonder, does she use that?
A lot of time, she will. She'll say, I'll say, she'll just kind of ask, like, how are things going? And then I just really kind of dig in. And then she's like, let me just repeat that back to you. And I usually know it before she does. Like as soon as it comes out of my mouth, because we've been doing this long enough, I'm like, crap. Like I know where that's going to go, but that's just it, because I already knew it. It was already in my head, but yet I didn't catch it myself until I said it to my coach, who I know is going to reflect it back.
Hmm. Yeah, that's awesome that she does that. And it's funny that you already know it's coming. I'm like, wow, you guys are probably playing pretty good chess by now. But it
Yeah.
is a really great way to expand this box like we're talking about, because it is so fascinating how much people actually know. But it's like they almost need someone to just ask again and let them expand on it. And then it gets this like second degree of color, third degree of color. And you're really, really moving then. It's such a like rewarding part of coaching. Yeah.
Yeah. Yeah. It's something that I really wish people had more access to. And that's what we're going to do.
Yeah.
We're going to
Cool.
create access.
Awesome.
Yeah. So cool. All right. Well, I think let's just kind of wrap it up here, because that was a nice introduction. What I want to do with Julia moving forward is I want to bring Julia back probably several times. Maybe we do this on like a regular basis. And we just like, I want to just hit on some of the powerful features of group coaching and coaching, and, bring those forward, whether or not people are going to do it with us or with someone else. I think it's an underutilized tool, especially in our audience in the osteoporosis space. I think that so many, especially women in this space, for whatever reason, this is a group of women who tend to be very anxious. They're great at identifying information, but not great at acting.
Mhm.
So many times we see that over and over again. They have the infobesity in the world. They have all the information that they need, but they don't know what to do with it or how to engage it. Or they start, but they stop because they're scared.
Yeah.
And coaching can be such a powerful tool there.
Yeah, absolutely. Love to talk more about that.
Yeah. So cool. I think we're going to end that here. And Julia is going to be, again, a part of the coaching platform that we're building at LifeMD. So for all of our patients that are going to be moved over there or start over there, that's where Julia will live professionally for the most part. And I'll bring her back here. We're going to talk more about some different things. But Julia, thank you so much.
Thanks so much for listening to that video. Hopefully you enjoyed that. And if you did, leave us a comment, because again, I think that we could do this on a regular basis. I've personally found coaching to be such a powerful tool in myself and in my patients that I want to be able to bring this forward, but I need to know that you guys like this is beneficial for you. So please let me know in the comments if this is beneficial. Also, if you haven't, please click that subscribe button. And remember too, that if you're having a hard time putting together your own health program specifically around bone health, and you have questions about bone health, your own course forward, or hormones specifically, if you haven't attended our masterclass, yes, please do that. The masterclass is designed to go through the top 5 mistakes that we see people making in their own bone health journey. And if you're making even one of these mistakes, it might significantly be reducing the benefit of all the effort that you're putting in, all the resources that you're putting into your bone health journey. So if you haven't done the masterclass, I would encourage you to do the masterclass. Totally free, link in the description on YouTube, or you can head to our website, osteocollective.com. That's osteocollective.com. And you can sign up for the masterclass there as well. I'll see you in the next video.